Well, first of all, I can tell you that Graham Giles is going to say that, that Michael Portillo started the procedure of shutting down the military hospitals under the last Conservative government. Before he does that, if I'm having to go first every time, I'm going to preempt him by telling you that yes, Michael Portillo did start the cause of shutting down military hospitals in the last Conservative administration, but in those days there were 7. It was actually Tony Blair in 1998 that announced that Haslar would be shutting. And Haslar, as we all know, was a valuable, dual and absolutely essential service in this community. I have many of my relatives that had surgery there. In 2007, it was nominated the 2nd cleanest hospital in Britain. It's a very valuable resource, and I think that it's an absolute crime that the Labour government shut that hospital down, not least because we are now seeing all these people coming back from Afghanistan having to go to Selly Oak when there was a perfectly good military hospital that could have looked after them. And I think that a decision taken by Michael Portillo before the government had taken us into 2 illegal wars is not one that the Labour Party can keep harping on about. I would also like to say that I've been leading a campaign to change the name of the Minor Injuries Unit at the Gosport War Memorial Hospital to an Accident Treatment Centre. I think the War Memorial Hospital needs to be allowed to do more, because at the moment one of the big targets, the QA hospital has a number of problems. It's failing to hit its targets in a number of areas. There are now 700 people on waiting lists for many, many operations, and it's just not doing enough. The expense has gone through the roof. So we have to recognise that the Gosport Memorial Hospital needs to be able to do more, and by changing the name of it, it persuades people. A minor injuries unit sounds like a cut finger or something. You know, actually it can fix broken bones. It's a very valuable local resource, and you understand as well as I do that in the modern world you have to use something or you lose it. You need to protect it, otherwise it will go. The other thing I really very quickly say is that our enterprise, who are the company that have taken over Haslar, want to bring back that site into community health use. They want to use it for things like physiotherapy and kidney dialysis in the long run. And I think that that's something, as an MP, I would work very strongly to ensure that that happens.
Absolutely, it's a complete disgrace, the health service as it stands with Gosport at the moment. There was no really valid reason, as far as I'm concerned, to close Haslar, and I can and have put my hand up and said it's had absolutely nothing to do with the Liberal Democrats. I would also like to add to that, because I've heard it several times about being taken into 2 illegal wars. Both Labour and Conservatives voted to invade Iraq. The Liberal Democrats did not. Now, I would aim at, and it's Liberal Democrat policy anyway, so I don't need to convince them, at giving local people better control over how the health budget in their town, in their area, is spent. Because you all know what you need here. You need decent outpatients. You need to be able to go locally for the issues and problems that you have as you get older. I know myself, I used to go over to Haslar for my hearing test, because I don't think anybody's noticed, but I need to use hearing aids in both ears. I now have to go over to QA. So, and there was a perfectly good unit there in Haslar. Why not keep it there? So unless local people really get more control over what happens within their area, within their town, particularly with these sorts of issues, with health issues, it's always going to be the same. It's going to be somebody somewhere in central government, in some Quaco, whatever it is, saying where you should go, whereas you should say where you should go.
Well, now you know you're getting to the political debate when you're setting the agenda so that the other candidate is actually looking into a crystal ball and trying to guess what you're going to say. Actually, I could have said what Gordon Brown said. You can airbrush your posters, but you can't airbrush your policies. Or I could have said, yes, Haslar closed on our watch, but it didn't close on our orders, which has also been acknowledged. The question is whether a jewel which was created in the time of Nelson can really serve the demographic needs of our peninsula and our area for the next 250 years. The Joint Chiefs of Staff said no, a private hospital developer said no, the NHS said no, and then very reluctantly in the end, Tony Blair said no. David Cameron came here after that and said he would reopen Hasler. Well, let's see whether he does that. Anyway, there are more important things to discuss than actually winning political points, because hospital care matters to me living here, and it's valuable to my neighbours to get this right. One of the ways that we're getting it right at the moment is the huge investment that has been made in the QA hospital, in the Gosport War Memorial Hospital, and in the ambulances that are sitting at strategic places all around Gosport. So if we have a baby, I don't know how many people in this room are likely to, or a stroke, or a heart attack, an ambulance can be to you with paramedics within 4 or 5 minutes. That's faster than most other places in the southeast, because we're living in a peninsula. So, yes, we are setting the agenda, but one of the first things I would like to do is to make sure that we get direct public transport to QA. That's not moaning over the problems of the past, which we all regret. It's planning for the future that matters to our life.
Well, of course, when Hasler closed, I spent time in Hasler not being well for a short while, and the best hospital care anybody could ever receive. It was a real, you know, you could look forward to going into Hasler, couldn't you? Like worrying about it. It was like going on a break, you know. We needed that, didn't we? I was absolutely in disbelief when Hasler shut. And again, I'm going to say this, and I've said it, you know, successive governments, Labour, Conservative, they argue amongst themselves all the time. The fact is, they shut it. That's the bottom line. Nothing else. They allowed Hasler to be closed. There are more people dying on the way to QA, okay? There are more people dying on the way to QA in ambulances because they cannot get through. We need accident and emergency treatment in Gosport, and we need it now. Remind about all the other. We need a fully equipped hospital to deal with all our ailments. We shouldn't have to get and have a 3-hour ride out to QA if you're using public transport. It's an absolute disgrace. And our hospitals and everything else are being run by these so-called healthcare trusts, administrators, not doctors, administrators. They're on huge money. Why are they on such big wages? They're actually making a complete mess of our health system, and that has got to change. We want our doctors to run our medical care and say where they need their service, where they need all their equipment placed, and Hasler is the place for it. It's still there, the equipment's there, let's get it back and get it used.
I would certainly support the Accident Treatment Centre at the former Hasler offering as much as possible. Also for the War Memorial to do more. I know getting to Queen Alexandra Hospital is expensive and difficult, but again I refer to better use of the community car schemes and families, because this is what those two functions are all about. It's so easy to grumble about the National Health Service. I would say, in my 22 years in Stubbington in the constituency, my earlier life in rural Essex, I have nothing but praise for the National Health Service, and I say that having a 90-year-old father who died recently in excellent care, and a continuing 86-year-old mother who's receiving excellent care. So I repeat, I have nothing but praise for the NHS service, and I have no political axe to grind.